I've had a couple people ask me in the comment section of some of my other YouTube videos, how does the stress of being a CRNA compared to the stress of being an ICU nurse? So I wanted to go ahead and make a video about it. First off, I want to say that both jobs are stressful or have stressful moments. Just because I've become a CRNA doesn't mean that I forget the moments where I was working in an ICU and was very stressed or very overwhelmed. This video is more to talk about the different elements of both jobs and different things within both jobs which make them stressful. And in my opinion, if you can handle the stress of being an ICU nurse, you can handle the stress of being a CRNA. Of course, being a CRNA is not just about being able to handle stressful moments or situations. It's also about being intelligent and motivated and wanting a higher level of autonomy within your work. Because at the end of the day, stress is stress. So let's talk about some of the different aspects that make an ICU nurse stressed versus a CRNA. So one thing that really caused a lot of stress for me when I was working as an ICU nurse was time management, or just feeling like I didn't have enough time to do all the tasks that I wanted to do. As an ICU nurse, you're juggling multiple patients with varying degrees of needs, and you also spend a majority of your shift being a middleman for the pharmacist or the doctor, for family members of your patients. You get pulled in so many different directions throughout the day, and it makes it just hard to stay on top of everything and provide the best patient care that you can provide. Overall, my time management as a CRNA has been a lot easier. I'm taking care of one patient, and even though the patient can have a lot of comorbidities or can be a trauma case or a lot of things going on, you're giving blood, starting an art line, intubating, it's nice to be able to focus on one patient. And you also usually, depending on where you work, have help from other CRNAs that are available, the anesthesiologist, if there's an anesthesiologist that you work with. So you just have more time to focus specifically on one patient, which is really nice. So as far as how much time, as far as time constraint, definitely felt more of a time constraint as an ICU nurse versus being a CRNA. Another aspect of both jobs that can cause stress is the amount of responsibility that you have. So CRNAs overall definitely have more responsibility in providing patient care. As a CRNA, you're deciding which drugs to give the patient during the case. Does the patient need an LMA versus an ET tube? Do you want to do an awake extubation or deep extubation on a patient? Does the patient need a second IV? There's a lot of responsibility as a CRNA to decide what is best for your patient at a moment's notice. There's also a lot of risk involved in the care we provide because of the different medications we give, the different side effects those medications can have, and that can range from giving medications such as like a narcotic, and you have to worry about the side effects of the hemodynamic side effects, such as decreasing the patient's blood pressure, or the side effects such as like nausea and vomiting you may have to worry about once the patient wakes up, decreasing the patient's respiratory drive. And as a CRNA, the majority of the time you're alone in the room as the only anesthesia provider. Yes, some places you work there may be an anesthesiologist available, maybe another CRNA, but some places if you're an independently practicing CRNA, such as in a rural hospital or outpatient GI or like in an office setting, you're the only anesthesia provider, or it may take another like 5 minutes before another anesthesia provider will be available to help you. So you have to be ready at a moment's notice to handle any emergency that can happen with the patient. Even though you have nurses, like the circulating nurse in the room, there's only so much they can help you with. Of course, having a great circulating nurse is so important and so helpful. Like having someone else who can bag the patient or run and get you supplies if you need it is very helpful. But at the end of the day, you're still the anesthesia provider. You're still in charge of like the patient's hemodynamics and airway. So it's a lot of responsibility. As an ICU nurse, you definitely have a lot of responsibility, but there's typically a doctor or a nurse practitioner or PA who are helping to guide care. And if you need guidance, or if you need, if there's an issue with your patient, there's somebody else who guides the care and is telling you which drugs to give or what to do next as far as the plan of care for that patient. Just to add this in, so there's no confusion, Just because an ICU nurse is not the one placing orders or putting in central lines or art lines or intubating the patient, that does not negate the fact that a good ICU nurse makes a huge impact on patient survival and playing the role as a patient advocate. A good ICU nurse 100% contributes to good patient outcomes. Another question that I often see asked is, how does the schooling of being a CRNA, how does CRNA school compare to nursing school? And for me, CRNA school definitely was a lot harder. Not to toot my own horn or anything, but I don't know, for nursing school, I just feel like I didn't have to study nearly as much as CRNA school. I feel like a lot of the time for nursing school, I studied the weekend before a test, and I did study. I put in a good amount of studying for nursing school, but I could just study like that Friday, Saturday, and Sunday before a test and do pretty well on it. Whereas with CRNA school, for me, I could not just study the weekend before a big test. I had to be studying weeks leading up to it. Maybe that could be putting in like an hour or two every day, and then the weekend before the test, like putting in 8 hours a day, 6 to 8 hours a day, studying really hard. But I could not cram in CRNA school for the most part. Like, I had to be studying continuously, really spending a lot of time making sure I knew the information. Also, I feel that clinicals for CRNA school were a lot more intense. Expectations were a lot higher, which makes sense. You're having a ton of responsibility, a lot more autonomy in your job as a CRNA, so I understand why my preceptors were on top of us to make sure we were providing good care and being safe. Whereas with clinicals in nursing school, I felt they understood that this was our first time, a lot of our first times at the bedside, talking to patients, so they weren't as intense. I didn't feel as stressed during nursing school clinicals as CRNA clinicals. So I remember my first day of clinicals for CRNA school. So at the time, 5 of my classmates and I were all living together because our first clinical rotation was all at the same hospital. So one of my classmates found a house that we all rented that had enough rooms, so 5 of us could all live together, and it was like 5 minutes from the hospital. It was awesome. I remember the day before clinicals, me and one of the girls in my CRNA class were literally just like so nervous because we knew how much responsibility it was to be a CRNA. And I just remember feeling so nervous the day before because there was so much preparation that was involved. And our program director let us know, like, expectations are high. They expect you to know all the drugs in the top of the anesthesia card. Like, if they ask you, how does this drug work? When is the peak onset? What is the duration of action? You are expected to know it. And there's a decent amount of drugs in the top drawer. Like, that's where you have like your Zofran, your paralytics, your Decadron, Toradol. Like, that's where all the anesthesia drugs are. And you were expected to know all of them and how they work the first day. So it was pretty intimidating. Whereas in nursing school, I just didn't feel like they expected you to know all of that. You were expected to know some things, like some of the main big drugs you were expected to know. But it definitely wasn't like the pimping. It's called pimping, how they ask you a ton of questions in CRNA school. Like, your clinical instructor will ask you about everything in front of everybody, and you're expected to be able to answer it and fire off the correct answers. There wasn't really like pimping, at least in my nursing school, where you were asked a ton of questions and expected to know them. Nursing school for me, at least, was like more forgiving of you not knowing everything and understanding that you're learning and getting comfortable with working in a hospital setting. Me and my classmate were pretty nervous because we knew that we were going to hit the ground running. There wasn't going to be any shadow days, where I feel like in nursing school, there's like maybe some shadow days where you're following around the nurse and like seeing how the flow of nursing goes, where in CRNA school, there's no shadow days. You have a limited amount of clinical days and you have a lot to learn. So it's like from the beginning, you hit the ground running. It's no joke. Another aspect of both being a CRNA and a nurse that can cause stress is the hours that you have to work. So as an RN, typically, if you're working as a bedside RN, you work a 12-hour shift, either 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m., and about 36 hours a week on average. Whereas a CRNA, your hours tend to be less rigid, and that can make it a little tricky because if you work at like a hospital or outpatient center as a full-time CRNA, the typical schedule is like what's called a number system or a waterfall system, where everybody gets a number and you're released based on the number you get as the cases go down. So some days you may leave at 12 o'clock, some days at 6 o'clock, some days at 2 o'clock, some days at 11 o'clock. It's all over the place. You can kind of guesstimate when you think you're going to leave, but if cases get added on, you might end up staying like 3 hours, 4 hours past when you thought you were going to leave. So me and another CNA was talking about this, and basically we both had to cancel doctor's appointments, cancel dentist appointments, because we thought we were going to get out by 4, but it's not looking like that. So I feel like being a CRNA, it's a lot trickier to plan your week, especially if you have call. You really can't plan anything on your call shifts, anything major. You may be able to plan to go out to dinner like down the street or go get coffee with a friend down the street, but at a moment's notice you can get called in and you have to leave. So you can't plan a doctor's appointment, you can't plan a trip, you can't plan anything where you are committed to something rigid. So I think that the predictability of an ICU nurse's schedule makes it less stressful. Of course, you have the element of working night shift, which is a whole different beast. Like, night shift is stressful in and of itself. But then again, like, CRNAs can have night shifts technically because you're working on call and you could have a very busy night shift. And I think even just the aspect of being on a call is stressful in and of itself. You don't know if you're going to get called in or not. You don't know if you're going to have a slow day or a busy day. Like, you could have a horrible call shift. You were up all night. You were up 24 hours because you worked that day like a normal shift, and then you worked a call shift overnight. So I just think based on the hours of being a CRNA, if you're doing call and all that, are more stressful than working a 12-hour shift as an ICU nurse. So yeah, both jobs are stressful in different ways. And like I said before, if you can handle the stress of being an ICU nurse, if you can handle the busy days, if you can handle the things not being predictable all the time, not going into a shift and not knowing how it's going to be, if you can handle all that, you can handle being a CRNA. But of course, being a CRNA is not just about being able to handle stress and take the sickest patients. It's also being like highly motivated, constantly seeking out opportunities to learn, constantly knowing that you're gonna have to change your way of practicing based on new evidence-based practice and new science and journals that are coming out that are telling you new and better ways to practice. So essentially, both jobs are stressful. They're just stressful in different ways.